Croesawu pawb I briefio heno. Welcome everybody to tonight's briefing. Before we begin, I'd like to provide a brief technical introduction. Now, we're using Microsoft Teams today, and this means that not only can you watch the meeting, but you can also take part. On your screen, you should see a tab with a question mark on it, and this will normally be in the top right of your screen. And if you click on this, it gives you the opportunity to ask questions to our speakers here tonight. Now, please accept our apologies that we may not be able to answer all of the questions raised during tonight's meeting, but we will continue to update our website with the latest information, both about COVID-19 and also about our wider strategy and plans. Now, Microsoft Teams also offers you the opportunity to see live subtitles of today's proceedings. So you should see a button in your settings to switch on those subtitles, and they should be available in English and Cymraeg, as well as Arabic, Polish, Bulgarian, Slovak and Urdu. Today's meeting is also being recorded, so don't worry, it doesn't share any information about you in the audience, just the information you see broadcast on the screen today will be visible. So it means that people who aren't able to join us this evening will still be able to watch today's briefing. And we'll also be joined tonight by people on Facebook, as well as we're broadcasting the session through Facebook Live. So we look forward to interaction through Facebook Live as well. So thank you very much for joining. And without further ado, I'll hand over to Carol Shillabeer, our Chief Executive.
Thank you very much, Adrian. Prynaim da pawb, Carol Shillabeer ydw I. Good evening. It's a lovely evening. I hope it is wherever you are. And welcome again to our regular briefings. And I was just reflecting that it is about a month or so ago since we held the last briefing, and we featured mental health services there, and thank you for the feedback that we've had on that presentation and the content of that. Tonight we are featuring workforce futures, and I envisage another very interesting, thought-provoking presentation and an update on our ambition here in Powys in relation to career opportunities. I'm delighted that our guest speaker tonight is Sarah Powell. Sarah is an Assistant Director of Organisational Development in the Health Board, and is presenting on behalf of really some partnership working, which involves the Health Board, Powys County Council and the Powys Association of Voluntary Organisations. So once Sarah's done her presentation, I'm going to come back and do my usual sort of update on briefing on all matters COVID and in particular the vaccine programme, and then we'll be delighted to take questions and answers on any matters that you may want to raise. So thank you once again for joining us, and I will hand over to Sarah. So thank you very much, Sarah, for agreeing to do the presentation this evening.
Thank you, Carol. Good evening, everyone. It does give me great pleasure to spend some time this evening with you, just really sharing some of the exciting and innovative work that we're developing, as Carol said, in partnership. I have a series of slides, I think there's about 8 or 9, to just talk to you for about 10 minutes. Some of the slides I'll go into a little bit more detail on, and the final few slides will just be a high-level overview, but really excited to share some of the work. So the first slide that we're looking at really talks about the Workforce Future Strategic Framework, which was a key enabler of our health and care strategy. And the Workforce Future Strategic Framework was developed with over 300 people, both workforce and members of the public and community, to shape the programme of work for the next few years. And that work evolved into 5 key themes, and you'll see those key themes on the screen there. They are workforce education and training, designing and planning, and attracting the workforce. And those are the 2 I'm going to really talk about in more detail over the next couple of slides. The others that I will just give you some information about will be the partnership and citizenship theme, leading the workforce, and engagement and well-being. So if we move to the next slide, I'll be able to share some of the work that we've been doing. As I said, there are 5 themes. The first theme is around education, training and development. And some of you may have already heard about our Health and Care Academy, and that's both a physical space and a programme of work. And I'm going to talk about both through the presentation, and it's incredibly exciting that we're leading the way on this across Wales. Nobody else is working in the dedicated health, social care and community and voluntary sector, and this is in response to a Wales-wide request, really. So by 2027 we aim to have a truly integrated Health and Care Academy established. That's a physical space and a dedicated programme of work. This will include a model that has been developed through the work of the framework, and it has 4 schools. You'll see on the slide that there are School of Research, Innovation and Development, the School of Leadership, the School of Professional, Clinical and Education and Training, and the School of Volunteers and Carers, and that includes paid and unpaid carers and young carers. And if we move to the next slide, I'm going to talk a little bit about the physical space at first, which is classed as our hub. It'll be based on the Rontlys campus. Some of you will be familiar with the Basilberg building. And the pictures on the screen are really a 3D graphic design of the state-of-the-art infrastructure that we're working to at the moment. So we're currently in the construction phase and development phase of that, but it will enable our community, our citizens, you, the people listening tonight, to be able to enter and participate in some face-to-face learning, but also experience it through a whole range of virtual and digital learning mechanisms. This will be the initial part of the Health and Care Academy in terms of the hub. There will be other spoke physical spaces, part of the North Paris Wellbeing programme. We're also looking at developing a bungalow in terms of assisted living, so that how we can support people to live effectively at home, how we can train our staff to work with those people to keep them in home, and how we can also ensure that we are testing and trialing the latest infrastructure and gadgets and digital technology to support people to stay at home. So those are some of the exciting things that we're working on, and I'll talk a little bit more later about when that goes live. If we move to the next slide, that will talk about actually the Health and Care Academy model in a little bit more detail. You'll see down the right hand side, it looks very futuristic, but this is the future, and this is the future that we're in right now. The ability to utilise AI and technology to not only train, but to really explore and develop our joint training and our joint development together. And our ambition, as it says on the slide, is to be a rule exemplar around professional and clinical education. And some of our work has already started, so we're not waiting just for the physical space to be built. We've already started on the academy work. We've started work with Aberystwyth University, looking at a rural nursing degree that will have a clear focus and element and footprint within the county of Powys. We're looking at working with Health Education Improvement Wales on our primary care academy. We're looking at being the sector of choice by growing our health and career pathways, and I'll talk a little bit more on another slide about that, but there's some really exciting opportunities for people to develop their career, both in county, but also step on and step off and step between, so step between health and social care and the voluntary sector in terms of careers. We'll be looking at leadership and our talent, and that leadership is from operational right through to strategic level, and operating a number of delivering a number of programmes of education and training within the county of Powys, so people won't have to leave county, right through from level 3 up to master's levels. And also in terms of looking at people's needs, I think I've mentioned that really, but really focusing, and we've done a huge amount of work with our colleagues in Parvo around shaping what the School of Volunteers and Carers and Unpaid Carers will look like. And we've included our volunteer carers in shaping that work, and that work is due to come forward shortly, so we'll be able to share that with you, but some really exciting opportunities there. And then really to build on the ability to test and trial and pilot and really get in and closer to research and development and build on the work that we already do. If we look to move to designing and planning and attracting the workforce, which is on the next theme, on the next slide. Thank you, Tim. This really is about the career pathway, and it's one of the schools in terms of designing and attracting the workforce. And this is incredibly exciting because this work has already started. So on the screen, you'll see RON, which is a European funded project that we've been successful in. It's joint with the council and Parvo and delivered in partnership with Neath Port Talbot College. And we've just started that piece of work, and that's really an offer to not only our workforce, but also to participants or people in the community about helping them to be employability ready. So training, key skills, CV writing, really providing that offer so that people feel that they're able to put themselves forward for jobs. The Kickstart is a new government scheme that we have been successful in being awarded to be a gateway employer. We're the only health board in Wales that is a gateway employer, and we're due to go live week after next with our first placements of the young people aged between 16 and 24. They will be offered 6 months work placement, paid work placement, and the wrap around that is also we will provide CV writing and opportunities for them to participate in progressing into further employment. That is a huge piece of work, and we're really excited by the traction on that. The South Paris education pilot for school children is something we're currently working through with our education colleagues as what offer we could provide for young people to help them inform their choices around careers. I think, if you think health, people just think a nurse. There's far broader opportunities, and part of that programme will be to look at health and social care. I'm going to call it an introduction programme of learning for school-aged children to come and participate in, as well as alongside their academic school provision. And finally on that slide really is the apprenticeship programme, which we have already commenced. We started very small. We had 2 healthcare support worker apprentices. They've now got substantive roles in the organisation, and we're developing the joint apprenticeship scheme with our health and social care colleagues. For those of you that have been on our jobs pages, we've got our next cohort of apprenticeships out, and that is a great place to start because for me you can earn while you learn, and get a real feel for the industry and the sector. If we now have a look at really just a bit of a whistle-stop tour, I suppose, of the last 3 themes within Workforce Future. So partnership and citizenship is really important. And as I said, the volunteer and caring work, we've been working with Parvo. And, no doubt you will have all seen the amount of volunteers that have been supporting the Mass Facts programmes has been incredible, and the passion and motivation that the volunteers have brought with that has been second to none. But really shaping what is the offer for our formal and informal opportunities for our carers and volunteers to be participating in the Health and Care Academy education and training offer. And that's being worked up as we speak with our colleagues in Parvo. And part of that will be shaping what our career pathway for our volunteers may look like. The next area really is around leading the workforce, and huge amounts of work going on here really. So bringing together some of the joint pieces of work that we currently do across the partnership. So looking at how we can really maximise our management inductions, find out the programmes of learning that our staff need to upskill on, ensure that our leaders are working at the top of their skill set, and that we identify our talent across the piece, and we provide programmes to support that. We're looking at MBA placements, and we've got two shortly to join the organisation, and really linking in with national initiatives such as the Health Education Improvement Wales Compassionate Leadership, and some of the intensive learning academy work, which will lead us to really develop our leadership digital transformation skills, and part of the physical space within Basel Web will really enhance that, and then really developing and expanding our coaching and mentoring offer. And then I think just finally, really, before I then pause so that you can gather your thoughts, is really around is engagement and well-being. This piece of work is already underway. You know, most of us, everyone's had to work in a very different way during COVID, and we really want to capture, you know, the best of that, and develop our agile working cultures across the patch. Our coordination of our respective partnership internal engagement opportunities, so our chat to change and our engage for change is really important, and that's the voice of the workforce in the community, really shaping how we do things. A big focus will be, a part of our work will be our wellbeing offer, to really enhance that and support the workforce in the community around their well-being, and the programmes of work that will sit around that. And as always, our engagement is really important, and we will sense check engagement and through surveys and temperature checks with our workforce. Again, you know, there's a number of awards and recognitions that we've started to run both in-house for our health and social care colleagues. And so really the next steps, I suppose, in terms of the Health and Care Academy is to focus on the physical build, making sure we complete that, and that, you know, it is the state of the art, and it is a transformational and inspiring place for people to come, that we develop our well-defined programmes of work for the next 1 to 3 years, some of which have already commenced, and that we've already started our joint programmes of training this autumn. So that's been a real whistle-stop tour of some of our exciting opportunities that we're working on at the moment. Thank you.
Thanks so much, Sarah, for taking us through. And I recognise that it is whistle stop, but I think, as Adrian mentioned earlier, in these sessions we do try to ensure that they're able to be viewed afterwards. So for people, if they want to spend a little bit more time going back over that, there is that facility to do so. And can I just say how excited I am that this Health and Care Academy is now really getting off the ground. I know that there's been a huge amount of thought gone into this, lots of discussion, as you said, engagement of over 300 people in shaping this, and now starting to become a reality before our eyes, and is a really, I hope, very positive offer for people in the county. I know that there may well be questions, Sarah, for you on some of that presentation, but if I allow you just to gather your thoughts and regain your breath, I thought it might be useful for me to move on to the COVID update, and then we'll come back to questions and answers. So for anyone who's watching us at the moment, wants to put a question forward, please do. And whether that's on the Health and Care Academy, or whether it's on anything that I say here, or any other subject, happy to have a go at most things. So lovely. So what I'm going to cover is the COVID-19 pandemic, where we are now, where we are on the vaccination programme. And then I'll just touch on a couple of other elements as well, if I may, really about recovery and renewal. So I think if you're a regular viewer, you'll be familiar with some of these slides. So they seem to have worked in the past, so we update them and present them again. So we're going to move to the next slide, which really just gives us a bit of a reminder of where we are now with a number of cases and the level at which we're operating in terms of restrictions, etc. So we're at level 2, but we're moving into level 1 from a government perspective, but we're not quite fully in level 1. So I think that reflects the level of caution that is being used at this stage, because of course we do have a new variant that we're dealing with, the Delta variant, and some people may well be aware that the first cases of the Delta variant have been confirmed in Powys this week. And it is not a surprise in many regards, because the variants become more dominant, and so there is potential now for the Delta variant to become more dominant. But I'm going to come on to the very good news about the vaccine programme shortly. But that's where we are now. And we need to be aware that the pandemic is unfortunately still here. It's not disappeared entirely. And there is a third wave of coronavirus now being talked of as being inevitable. And for some, we're starting to see the start of that, particularly in some parts of the UK. So it's really important that I can underline the essential nature of testing. And whilst there's been so much focus on, rightly so, vaccination and our way through the pandemic, it is testing that really does make a significant contribution to us understanding where the virus is, understanding how quickly and how far it is spreading. And now our testing capability is so much greater than where we were at the beginning of the pandemic. So just to help explain this slide, so PCR tests are the tests that you have at the sort of the test centres as such, although you can have those sent to home, of course. And then there's a lateral flow device. They've been coming into place more so over the last few months, and particularly in school settings, but more so now in employee settings, unpaid carers, volunteers, etc. And I'd like to stress that from the 7th of June, so we've just started this now, the walk-in rapid testing pilot in Newtown. Newtown, obviously our largest town, biggest population in Powys, and if you're in that area, or if you can get to Newtown, that walk-in rapid testing facility is also available. But there is now a range of testing, and I would encourage you to please avail yourself of testing, because whilst we have had 4 cases in the last 7 days in Powys, and our case rate is 3, we know that it is very easy, and it can escalate quite quickly. So we're determined to do our bit to help the county keep on top of this. So I'm going to move to the next slide now, where it gives a little bit more on the vaccination success. So just wanted to flag, we love seeing these numbers, because every jab is a step closer to being protected. So every vaccination absolutely does count, and the people of Powys have been absolutely phenomenal in attending the vaccine centres or GP practices where it's been available through there. And as you can see just on that slide, 167,600, and it'll be more than that each day as we progress through. So the first dose and the second dose regimes are working very well indeed. And just to give you a little flavour of 1 week, in 1 week over 8,700 doses were administered. And that means now anyone over 18, so this is all of the adult population, should now have received a vaccination offer. And I'll come on to uptake rates shortly, but if you know of anyone over 18 who has yet to have that offer, there is a priority access form on our website. Please do use it, because we have got vaccine that we want to give to people who've yet to have their vaccine with us. The next slide gives us a little bit more detail. And for those of you who have tuned in before, you know I love this graph, the green bars and the blue bars. But just to explain, for those who may not be familiar, so the bottom chart really is that cohort group, and we know the cohorts 1 to 9, and then the rest of the population. And so we're dealing with all of the cohorts now. You can see that the green line is where a first dose has been administered, and the blue line is where the second dose has been administered. So what we're wanting to see is the blue line filling the bar, and you can see that for the top categories there, and they're particularly residents of older people in care homes, and that gives us real confidence of protection. And then we work through the age group, but also include care workers, both health and social care. Now, where there is green, it may well be that the second dose vaccine is not yet due. So there is this gap between first and second dose. But that for us is an extremely healthy picture of vaccine uptake. I'm going to come on to vaccine equity shortly, but that is really, really good. And then the top graph, just in case you're wondering what that is about the numbers of people in each of the groups. So you can see some groups are bigger than others, and you can see that the groups, again, the green and the blue mean the same thing about first dose and the second dose. So on first doses, 97% of people in the groups 1 through to 9. So that everyone 50 and above, 50 years old and above, or people who have an underlying health condition. So 97% of those people have had their first dose, and 79% have had their second dose. This is stuff that you dream of, really, in vaccine programs, particularly at this stage of the vaccine program, and with the scale and the pace in which we've had to get this up and running. Then just to, again, another stat for you, if you like these things, 91% of the total population, everyone has received their first doses, adults and eligible. We may come on to children in a moment. And then 57% of them have had a second dose. So when we're looking at particularly things like the Delta variants coming through, we know first and second dose uptake is really important. We're in a good position there. The next slide, please, is there we are, just a bit of a comparator. So if you're wondering how Powys is doing in comparison to other health boards, this is the slide for you. And then if you also have got some interest in what about internationally, you can see the chart on the left shows the international picture as well. So Wales is doing extremely well overall, and has got the highest vaccination rates. So, you know, I think we can be really proud of actually the whole community effort there's been across Wales to enable this programme to deliver so many vaccines in such a short space of time. And that takes me on just to the next slide. That gives us a bit more of a sense of the key milestones. And I'm just going to skip through this pretty quickly. So by mid-February, which seems an age ago now, we needed to have offered the first dose of vaccine to everyone in groups 1 to 4. So they're the most vulnerable people, and we achieved that. And just by way of update, so the second dose is already delivered to over 95% of people in P1 to P4, priority group 1 to 4. So please, again, if you know people in this category, so it's their over 80s, 75 to 79, age 70 to 74, and those people who are clinically extremely vulnerable. If you know anyone who hasn't had a first dose or a second dose, we've got priority access available for these people. So please do encourage them to get in touch. The next groups, which is shown on the next slide, gives a sense, again, we achieved the milestone here by mid-April, and you can see the age groups there. That's everybody over 50 and those with underlying health conditions and unpaid carers. So again, you know, phenomenal uptake. 79% of people in P1 to P9, as I say, had the vaccine. Again, priority access available, because we're now pushing on to make sure all these people have had their invitation for their second dose and have been able to take that up. So job not done yet. So if you know somebody in that group who is yet to have their second dose and they haven't had an appointment, please do come through to us. The next slide talks about the milestone, which is at the end of July, so the end of next month, and I'm pleased to say we're ahead of schedule for that. And that was really the target was to offer everyone over 18 a vaccine by the 31st of July. Over 3/4 of the people aged 18 to 49 have already had their first dose. So the numbers are a little bit lower here, and again I would encourage people 18 and over who have not yet had their vaccination to come forward. There is priority access for this group as well, particularly around first doses. And anyone who is under 40 that doesn't have an underlying health condition, we've got the Pfizer vaccine, and we follow the guidance of the Joint Committee on Vaccination and Immunisation, and we have had a really good supply of Pfizer vaccine to support people. There is three vaccines that we use currently in Wales, although they're more are on their way. So we're really pleased with this. We've got ahead, and so our efforts are now particularly focused on second doses and anyone who is left who hasn't had a first dose. And we recognise that some people might have been hesitant to have a vaccine and wanted to just wait and see. Well, if you know of people who've been waiting and seeing, please do encourage them to speak to us about their choice of taking up the vaccine. We're now pretty experienced at this as a country, and we can really see the impact of it. So the next slide will take us to really next steps, whether you're watching on Facebook, whether you've joined us on Microsoft Teams, whether you're with us live or whether you'll be catching up, always ask for your help. If we can, please spread the word that anyone over 18 who has yet to receive their first dose, then get in touch with us for a speedy appointment. We're working very hard to make sure that second doses are out there as well. It really is key for people to come for that second dose. And in particular, of course, with circulating new variants, we need full protection. Now, we are awaiting a bit more guidance to come our way on a booster programme, so a third vaccine, and we're hoping that certainly later this month we'll have more information from the JCVI on that, but we are planning ahead. So we're planning for an autumn booster programme. And of course, we've, with the experience of undertaking nearly 170,000 vaccines, we'll be keen to get stuck into the booster programme. We are also very mindful that there's discussions going on about children or teenagers, really, those in the 12+, and we recognise that the Pfizer vaccine has been passed by the regulator for use in 12 to 15-year-olds. It was already approved for 16 and 17-year-olds. So we'll be waiting for government guidance on that. And so our other big focus now is making sure that there is no one left behind, that through June in particular, this month and into July, we will be interrogating the data to check that there aren't people that haven't been offered, or that there may be some groups who need a bit of extra support, and we've been trying to work on that all the way through, but we are going to give it a really big push during June. So your help on this will be really welcome for people you meet who may have decided not quite to come forward yet. Please do check our website. There is daily updates going on through there. And again, huge thanks to the communication and engagement team for keeping this information live. So wonderful effort to keep us all informed. And then finally from me, you know, the pandemic isn't over. We're really fighting very hard to see the back of it as best we can with the vaccine programme. But until that time comes that we can be fully confident that we're not going to have any further waves here, it is a hands, face, space and fresh air message, of course, to conclude on. So I think that may well be it from me. As always, it's a great pleasure to be able to update you on the work of people right the way across our communities. And again, really sincere thanks to volunteers, to Powys County Council, to Health Board colleagues and to communities and community groups themselves for participating and helping to make this work so meaningful and so successful. There we are. I will just hand back to Adrian now, because in good old-fashioned style, Adrian helps to compare the next part of our session tonight on Q&A, questions and answers. So it's not too late to lodge a question. And as Adrian said at the beginning, we'll try and get through as many as we possibly can. So thank you very much, Leo.
Thank you very much, Carol, and also thank you very much, Sarah, for two great presentations. Actually, really great to hear about the progress underway in the Health Board and more widely with all of our partners. Now, we've had some good questions through both from Facebook. I'm watching Facebook on to the side of me here, and also through Microsoft Teams as well. So first of all, had quite a technical question asking about the sublineage of the Delta variant that's present in Powys. So rather than putting any of you on the spot, I can answer that was the B.1.617.2 lineage that's been identified within Powys. In terms of other questions that we've had in, Carol, this might be one for you, just asking, because we're now seeing the Delta variant, what, if any, plans might there be to speed up vaccination?
Yeah, thanks very much for that question. And it's a very sensible question, because we can see across the border in England that there is that speeding up of vaccination. And so perhaps if I just start with saying that we have got some flexibility based on the incidence of the Delta variant in our own local areas, to take decisions to accelerate vaccines to some extent. And obviously supply is dependent, that being dependent on supply. What I would say, though, is that we have got such good uptake rates, and we have managed to progress so quickly, much more quickly than our best expectations, if I'm honest, that it is unlikely that trigger will be met to have to bring forward and accelerate even more. So when I talk about 79% of people in groups 1 to 9 have had 2 doses, and 57% of all people have had 2 doses, we know we're doing 8,700, we shared vaccines in a week. We're really getting through this very quickly now, but we will be keeping very, very close watch on the Delta variant. And again, supply permitting, if we meet the trigger that we have to expand, then we'll be doing our very best to expand and accelerate even further. But we're moving so quickly now that I think on the whole we're pretty pleased. Government are pretty pleased with where we've got to already, if you like, without having to take that additional decision. Thank you, Adrian.
Thanks, and yes, I think we've got lots more second doses coming up in the next couple of weeks as well, so we'll see those figures climb even higher of the number of people who've got double dose protection in Powys. Now, COVID obviously has a direct impact, but there's also the wider impact on the rest of our health services that people are concerned about. And so we've had a question here asking what plans PTHB has for reducing those waiting lists that are growing and for addressing that backlog of need.
Yeah, brilliant. Thank you. And I should have mentioned in my briefing, but I wanted to get to questions and answers. Two things, really. One is about what we call essential healthcare. So these are the services that we provide, and we've been trying to provide to the very best of our ability through the pandemic. And we've had to provide them in slightly different ways. But so essential healthcare services are open. There is still some digital delivery of that, but increasingly there is face-to-face opportunities as well. So that's good. But in terms of backlog, I'm really pleased to be able to share that we've had an allocation of £2.5 million from Welsh Government to try to expand our service provision to people, to residents of Powys, and that Powys residents will be able to access expanded provision in health boards elsewhere in Wales and to English trusts as well, who of course support our population with secondary healthcare. There's a lot to do, and there are some real challenges around that. The waiting lists, I'll be completely honest with you, are the highest they've been since my time in Powys, and that's well over sort of 11 years now. But we have got a huge amount of commitment to work to try to bring those down. We have got some practical issues such as the workforce, and we've just had a fantastic presentation on workforce, but we haven't got all the doctors, nurses, therapists, etc. that we need, not just in Powys, but across the NHS more generally. So we know that there will be some challenges there. But if I just give you a very quick flavour of the work that we're doing, we're working with people who have long-term conditions, working with children and young people who have been disproportionately affected by the pandemic, not just in their education, of course, that's been, you know, a real challenge, but also in their social interaction, social development, and to some extent their access to health services. Working on planned care, so outpatient appointments and operations, but also working on what advice, support and well-being help we can give to people. And of course, we're working on pathways around mental health and cancer. So a huge array of work going on at the moment. And if you are interested to drop into our board meeting later in the month, there'll be more detail in there, or have a look at our board papers on that as well. And it may well be, Adrian, that we do a feature on this at a forthcoming public briefing such as this for the future. So thanks for that. A lot going on.
That sounds like a great suggestion, and I think if people are interested particularly in mental health area as well, obviously that was a key focus for our last session, and the video of that is still available to watch online if people weren't able to join us on the day. Now, we notice on Facebook as well, I've got a very specific question from an individual about their second dose, so after I've finished today's briefing I will respond to you direct on that. Now, several questions here linking back to Sarah's presentation. Firstly, the plans for the Health and Care Academy sound really exciting. When will it open?
Great question. I think my initial reaction is it's already open. In terms of we're running programs and projects and training, but in terms of the build, in terms of the Brontleys campus, in terms of our hub, we're looking at early autumn this year, swiftly followed by the assisted living bungalow being March or April of next year. And we're already starting to scope what the education and training space will look like in the north part of the county.
Are you able to share any more details about the plans for the north?
I think at this stage we want to be assured that we've chosen the right thing to do on through the hub. So we want to test some of that, but pretty much scaling up what we've already got and making sure that The primary focus will be making sure around connectivity, so it doesn't matter where you are in the county, you can access the education and training. So great infrastructure and really modern, innovative space.
Fantastic, thanks. Now, question for you, and I'll probably also pose this to Carol as well. What would your advice be to a 15-year-old in Powys thinking about a career in nursing?
Oh, great question. I think we've got some exciting things in place for someone that's 15 in terms of, you know, your starting out career. I think my first response would be go and talk to our current apprentices about what they're enjoying about their journey so far. We are planning a series of virtual drop-in sessions where people can come and have that experience of a day in the life of and have some real understanding. We will start to be opening up what our work experience offer looks like, but I think what I would say is that come join us. We'll support you, we'll provide you with education and training, we'll nurture you right through from the apprenticeship route through to a registrant. So yeah, please welcome the conversation.
Brilliant, thanks for that. And Carol, I wonder if you'd like to come in on that one as well, particularly as you're a nurse.
Yeah, thanks ever so much. And I don't know how many people know that I am a nurse, and I've recently revalidated, so I'm still on the register. Look, I grew up in a semi-rural area in Monmouthshire, and I wasn't sure what I was going to do as a career, and I happened to go on a day trip to Cardiff. Dropped into the School of Nursing open day, and that was it. And I actually had to move to Cardiff to do the nurse training because it wouldn't have been very feasible where I was. And we've been reflecting that 15-year-olds in Powys may think that they have to move away, and we've been working really closely with the University of Aberystwyth because they are very, very keen to be able to offer pre-registration nursing courses, and we're really keen that they do that. So we've been working with them, and not too far down the road now, really within the next few months to the next year, more of the nurse education will be accessible within the county. That means, and then I think Sarah mentioned sort of digital infrastructure and technology. We've learned through the pandemic that you can do things differently. You don't have to travel everywhere. So for a core part of nurse training, you can actually do that online and working in groups linked into the university. So we're really excited about what that might mean to people who might have sort of dismissed that type of career because they didn't want to move out of the county. But I think the things are different now. I did a bit of research. This is just a little story. Back in the early 1990s about the perceptions of 15-year-olds to nursing as a career. So that question's taken me back a bit. There are so many opportunities for young people these days, but I'd like to say that there are so many opportunities in health and care. No two jobs are the same. There's a whole directory of different roles that you can take in the NHS and in social care. So I think it's an extremely fulfilling career. So if you like choice, if you like people, if you like development through the whole of your career, then please do think about health and care careers in Powys.
I think that's a really good segue into the next question, is what do you think are the main things that would attract NHS staff to come and train, work and live in Powys?
Oh, where do we start? Well, maybe if I just say my own personal experience, I came for 6 months in 2009, and I'm still here. So I think there is something special about Powys, and if I try to encapsulate that in just a couple of sentences, there's a real sense of community. And of course, there's community elsewhere in Wales, of course there is. But Powys does have something special to offer in terms of community, both in our communities, but also as a health board community. I'm always astounded by people who join us who say how welcoming and supportive their entry into the organisation is. And so there is this sense of joining a bigger Powys team that is meeting the needs, or certainly seeks to meet the needs of the population. We've got great training, even better training now for the work that Sarah and colleagues are doing. We've got very committed people. I hope that we try to make sure we get a good sense of well-being as well as work, and we try to promote that. So, and of course, I just emphasised in my last answer the variety of roles that there are in Powys. And for those who don't know much about Powys, it's closer than you think, and we've got a very exciting agenda that we're taking forward. So please do take a look and come and have a chat with us about potential opportunities.
And again, you're setting these questions up for me. That really fits into the next question that we've got, which I know has been a hot topic in your inbox as well, which is about the next steps for Knighton Hospital. So what's the current position with Knighton?
Yes, so thanks, and thanks to local community councillors and leaders for catching up with me on Monday evening about this, me and the team. And this is one of the challenges we've got, is that there is a national shortage of nurses, not just nurses, but other healthcare professionals as well. And everyone is after more nurses to expand, whether it be on planned care, whether it be on long-term conditions, etc. So we have got a real recruitment challenge. We made the decision, which was the right decision, to amalgamate the wards at Knighton and Llandrindod in the planning of the pandemic, and I'm very glad that we did, because we were able to sustain that even with staff absence. We have been very reliant on bank and agency staff to support us in Knighton, and it looked very, very difficult that we would have been able to maintain that through the pandemic, and I don't think we would have been able to. Our challenge now is to reopen the ward. We have had a go in autumn of last year, and unfortunately that was unsuccessful. We're looking for about 10, just under 10 whole-time equivalent staff nurses, and that is a very big ask when, of course, Hereford Hospital is also looking, and Ludlow and Leominster and those types of places around the region are also after nurses. So we're in dialogue about what else we can do. We've invested in therapies in the local community, so Home First service and enhanced district nursing service. So our primary aim is to support the people of Knighton and district wherever possible in their own home. We all want to be in our own home. So that's what we're working on, and look forward to seeing how we can develop again in discussion and dialogue with people in the Knighton area.
Thanks, Carol. I think I'm just glitching a little bit on my signal here. I'm not sure if you can still hear me.
Yeah, we're with you. We're with you.
Fantastic. I'm rural broadband at the moment is causing a few problems for me. So I've just got a few comments on Facebook to share. One saying great results in Powys Teaching Health Board on the vaccination. You're doing a fantastic job on vaccination. Good to hear it's still in top gear. And asking whether the booster will be 1 dose or 2, and clearly at the moment we're working on the basis of a single dose booster for our plans for phase 3 from the autumn onwards. We talked earlier about addressing the backlog in services. In terms of reopening services within Powys, GPs, dental services coming back on stream, where are we up to with that?
Yes, thanks very much. I think it's probably really important to say that both GP services and dental services have have been open during the main parts of the pandemic, but access has been different. And I'm the want to recognise that particularly around dentistry and dental services, it has been more challenging. And the reason for that is that, I don't want to get too technical now, but drilling generates aerosol, and an aerosol generated procedure is a much higher COVID transmission risk. And so the level of precautions that had to be taken in dental services have meant that there have been fewer appointments available. We have seen people come forward and access emergency dentistry. We've been putting in some additional services to help manage that. But we're really keen to make sure we get that right balance of protection on infection prevention and control and access. And literally this week, some colleagues of mine presented to the Community Health Council on dental services. We've had a recent presentation, so I know there's a lot of catch up to do, but our dental colleagues are looking to try to see as many people as possible. And then we don't all have to go for a 6 monthly check as we used to in the old days. It is based on the level of risk you have, the level of need you've got. You're better off trying to get some advice on that. But we are working very hard to improve dental services. On GP services, again, they've been open throughout, and often when people are not being seen sort of face to face, you do wonder what's going on behind the scenes. But I know that a lot of video consultations, telephone consultations, and email consultations as well have been taking place. And I also know that our primary care colleagues are very, very keen to do some catch-up work in areas of being proactive that they may not have been able to do. So again, that's likely to come through in much greater volume over the next few months. And we've got an eye on winter, and I know it's June and the weather's been lovely, but winter may well be very challenging. And if I can take this opportunity, it's slightly cheeky, I know, but to just give very, very early awareness of it's going to be really important to get a flu vac this year, because we know that we've all been sort of tucked away, haven't we, for a long time, and our immunity on flu may have waned. So, and that's one of the big things that come October, November, December sort of inundates GPs. So we can do our bit as individuals as well to try and help that. But I know our primary care colleagues, they're open. Please do, if you have any concerns, any worrying symptoms, get in touch with your GP. They are there to help.
Thank you for that, Carol, and really good opportunity there to promote that the flu vaccination season will be coming soon. Really so important for everybody to take up the invitation for their vaccination. I think I've got time for just a couple of questions. So one that came in on Microsoft Teams. Well done to the Health Board, the local authority and the third sector for getting the Health and Care Academy off the ground. Will this help us provide the rural health and care we expect over the next few years? Maybe I'll put that to Carol, is that okay?
Yeah, lovely. Well, it will certainly help. And, you know, we're a people type of sector. We can't offer services and support without people. And we think that the Health and Care Academy, whether you are a healthcare professional, someone thinking about becoming a healthcare professional, work in social care, or you're a volunteer and carer, you're really important to that whole family of support that we all rely on, actually. So it can only help, and I think it's a fantastic enabler to really raise the profile of Powys and health and care in Powys. So I'd love to be here a year from now and be able to tell you how many apprentices we've had, how many people have been through the Health and Care Academy programmes, what our volunteers and carers thought of the support that they've been getting. So I think that's one to come back to, but I certainly hope and believe that this is the right thing to invest our time, effort and energy in.
Right, I'm going to be cheeky and squeeze in one more penultimate question, if that's okay, which is where are we up to with the work on Machynlleth Hospital?
Oh, yes. So so much going on. We could have another hour here. So Machynlleth, well, many people will know that we've been looking to try to get our business case to support the redevelopment, refurbishment of Machynlleth Hospital into more of a health and social care centre, health and wellbeing sort of hub place. So having more available and accessible in Machynlleth. I'm delighted to say that Welsh Government are absolutely supporting us here, and work has actually started on site. So anyone who's in the Machynlleth area and drives past, you will see now on site construction, etc. It will take us some time to complete. So this isn't a 2-3 month program. This is a 1.5 year program. But I can't wait until it's done, because the designs are fantastic. We have had to, it's been a bit challenging. We've had to make some changes for the proper splays and the highways, and that's sort of caused a bit of angst and delay, but we're absolutely on it. So I'll be delighted again to show people a little bit more detail at a future event, Adrian. So thanks for the question. If you're anywhere near Machynlleth, have a little look as you go by and you'll see construction happening there. Hooray.
Sounds like a great opportunity to do some updates on our capital developments at a future session, doesn't it? So final question, and I'll put this to Sarah first and then maybe to you as well, Carol. So we've heard a lot today in the presentation about being healthy in the workplace. So what's your top tip for maintaining your own well-being at work, Sarah?
My top tip, I think, for me is to get my outdoor fix first thing in the morning with my 3 horses and my 3 alpacas and my little baby alpaca, followed by checking in with colleagues and team members. And then at some point in the day, and I'm not very good at having a lunch break, but at some point in the day, stepping outside and appreciating the beautiful part of the country that we live in.
Thank you, Sarah. And Carol?
Yes, thanks. As always, I'm being a bit sneaky here. I've got 2 things. One is having some laughter with colleagues. We have been working in a very pressured environment, but from time to time we could just come together and have a good old chinwag and share some laughter and some fun, some sort of downtime, if you like, and then so that's lovely. That's lovely to reconnect with people. And then secondly, I'm walking more, mainly because I think I'm going to get musculoskeletal problems by sitting in front of my laptop so much. So I've been deliberately making efforts to walk more, and I am going to do a short walk tonight to get some fresh air, and that helps with my well-being. Gives me a different sense of perspective.
Thank you. So I'm sorry to our audience if we didn't manage to reach all of your questions tonight. We're coming to a close now, so if I can invite Carol to just make some final closing remarks, and that will be us for this evening. Thank you.
Thank you very much, Adrian. And if I can...
You're on mute there, Carol.
Oh, no, I don't think I am. Yeah. Hopefully I can be heard. I want to thank you, Adrian, and to Tin and colleagues who help make these events happen. I do hope they're helpful for people who view, and I'm really pleased that we have had questions come through and people feel that they can ask those questions. So thank you so much if you've tuned in. Hopefully it's been of interest, and that if you've asked a question, thank you very much. I hope we've helped with that. As we've mentioned, we're doing a series of these. So we did mental health last time, workforce futures this time, and again next time we've already, I think, earmarked a couple of agendas that we might want to come back to. So hopefully you will join us again. As always, please get in touch if you think that we could make improvements to these. and if there's any particular topics that you think we should be addressing. So thank you all very, very much. Please do, if you haven't had your vaccines, please take them up. And remember just those precautions and keep safe. So thank you all very much. Diolch yn fawr iawn. Good night.